Yoga-enhanced cognitive behavioral therapy for women veterans with PTSD, a presentation by Kylie Anderson Thompson, Jessica Bellinger, Casey Jordan, Bree Nelson, and Bosie Welker. The following slides will cover challenges for women veterans with PTSD and why it matters for this target population.
Today we are focusing on women veterans with PTSD. The number of women enlisting in military services are increasing, and so are the number of women veterans. An article by Runnels noted that by 2035 it is projected that the women veteran population will grow by 8 to 15%. Although more women are enlisting and the women veteran population has increased, there lacks significant research regarding their military experiences. A few articles noted that a lack of research done on this topic can be due to a number of reasons. One of the larger reasons being that the women population continues to remain significantly smaller than male veterans. Despite having a smaller population and less research, women veterans experience similar rates of PTSD as their male veteran counterparts, and higher rates of comorbidity of PTSD and depression. One of the leading contributors to PTSD among women veterans stems from military sexual trauma, or MST. One article noted that 1 in 4 women have experienced MST while on active duty. To further put into perspective, the rate of sexual assault on women in the military is 21 to 25% or higher, and 24 to 60% for sexual harassment. These numbers may be different based on how many experiences are reported compared to not. MST increases the risk for PTSD ninefold, and 71% of women veterans with PTSD stated that they have experienced MST. Along with MST, an article by Kelly et al. Notes that women are increasingly exposed to combat-related trauma. Although the exact percentage of its impact on PTSD is lesser known due to widely varying combat experiences throughout women's military history. Why it matters. Even though they are faced with similar rates of PTSD as men and higher rates of MST, which is significant among women veterans with PTSD, women veterans experience greater barriers to VA healthcare services. These barriers include economic, such as lack of transportation, organizational, such as hours of care, and patient factors, such as poor health. These barriers are also compounded by the lack of women-centered treatments. One article noted that women veterans are less likely to seek out treatment from the VA due to a myriad of reasons, such as feeling uncomfortable around mixed-gendered services, especially if they have experienced MST, feeling as though their experiences are unworthy of VA support, and wanting to connect with other female veterans, but have had few opportunities to do so. Further, the women veterans noted that they feel their role in the military is minimized or misunderstood. Due to these barriers, women veterans often used avoidance or cognitive avoidance coping strategies and display the tendency to isolate themselves from others, furthering their challenges with PTSD.
Yoga-based cognitive behavioral therapy, a needed intervention. The following slides will define and detail why CBT's intervention and techniques.
The intervention that we chose is Yoga-Enhanced Cognitive Behavioral Therapy, also known as YCBT. YCBT joins together both traditional and alternative CBT techniques with Kundalini Yoga. Kundalini Yoga is a well-known and accessible practice in the U.S. that emphasizes a mind-body awareness and places importance on techniques for physical and emotional well-being. Each session contains yoga meditation, including breathing practices, loosening and warming up exercises, physical postures and movements, yoga meditations incorporating mindfulness, awareness, breath regulation, and deep relaxation practices. We will go more into these techniques in further slides. So similar to mindfulness, yoga teaches acceptance of the present moment. Participants are taught to notice and allow their thoughts and physical sensations without fighting or suppressing them. In sessions, participants are encouraged to hold Kundalini yoga poses while practicing breathing techniques and focusing on affirmations or alternative cognitive constructs in order to change unhealthy thought patterns. Both alternative and traditional CBT are aimed to restructure destructive cognitive and emotional patterns associated with the physical and psychological symptoms of PTSD in our case. Alternative CBT interventions incorporate not only restructuring the content of thoughts, but also the relationship and physiological interactions with the thought. The last part of why CBT is the process group. The process group gives participants the ability to explore alternative and traditional CBT techniques in more detail. They can share their experiences about engaging in yoga and meditation, discuss questions about challenges, and support one another. During group discussion, the interplay between cognitions, emotions, and physical sensations are reinforced and skills are taught to reduce the discrepancy.
Why CBT utilizes a multitude of intervention techniques. Because there is yoga involved in CBT, psychotherapy involved, there are techniques that relate to each. For instance, related to yoga are physical postures. So these are the physical movements, which are usually low impact, that you do in order to help get your body warmed and comfortable and get your blood flowing. Then there are breathing techniques, and these focus on long, slow abdominal breaths. Again, between the movements and these breaths, it's helping getting your body centered and helping you focus. And then there is mindfulness meditation, and these include awareness and breath regulation. So again, focusing on those breathing techniques that you're doing, but also just being aware of your body while you're doing those low impact movements. Example would be noticing how your feet feel on the floor, how your neck feels, are your shoulders tense, etc. And in addition to that, meditation is a cool down period, which helps clients have time to relax and maybe refocus and recenter themselves again. And all of these yoga related techniques are then followed up by CBT psychotherapy. Those exact techniques can be decided upon by the practitioner, but those CBT techniques are just used to focus on changing the content of the client's thoughts and then helping the client restructure the relationship that they're having to those thoughts. So again, we're focusing on the behaviors that we're doing and then the thoughts that we're having and trying to create a better connection between the two. Why CBT has a pretty straightforward intervention implementation. The studies that we read about discussed why CBT is typically implemented for 6 weeks at a time. These 6 weeks include weekly 90-minute sessions, and these sessions are broken down into 3 portions. So the first portion of why CBT session includes yoga and meditation. So again, this refers to those physical postures with low impact movements, and this just really helps the clients get their blood moving through their body and feel a little bit more centered and maybe a little bit more relaxed than when they came in, which will help them focus more on the second part of the session, which is the CBT psychotherapy part. So during this part, again, there are various CBT techniques used to help clients reflect on their thoughts and their behaviors and maybe restructuring the correlation between the two. After psychotherapy, there is a group discussion. So groups typically include about 10 people, and the 10 people get together as a way to end the YCBT session in a way that helps each other reflect on the feelings and thoughts that they had during yoga and how those meditating moments maybe impacted the CBT psychotherapy.
The next few slides will look at the evidence Who can use YCBT, and when and why it is used?
According to Skilbeck et al., a literature search was conducted in electronic databases, including PubMed, for articles on CBT and PTSD. The search was done with key terms such as cognitive behavior therapy, CBT, stress disorders, and post-traumatic, which resulted in 192 articles representing 58 randomized controlled trials. A further manual search found 7 further randomized controlled trials in the relevant area. Studies that did not include patients with PTSD or CBT or were not relevant to the topic were excluded. This left 31 randomized control trials involving CBT and PTSD patients. In addition, manual searches were conducted by researchers for relevant articles in specific areas for a comprehensive review. While the randomized controlled trials have established the efficacy of CBT and PTSD secondary to various types of trauma in different situations and age groups, various other studies have widened the applicability and usability of CBT in PTSD. Furthermore, there is extensive literature in this area which needs comprehensive review. A review of over 150 studies of yoga as a therapeutic intervention revealed a number of research trials reporting reductions in anxiety across a variety of medical disorders. In another review, researchers identified 8 controlled studies, all with positive results. Other single-group, uncontrolled studies showed improvements in anxiety for populations with primarily anxiety disorders and with mixed psychopathology. Furthermore, research suggests that yoga can improve mood, anxiety, sleep disturbance, hypertension, and headaches. Additionally, the meditative component of yoga practice involving relaxed control of attention has direct effects on cognitive activity by reducing the ruminative and mind-wandering activity of the default mode network, DMN, in the brain. Higher activity in parts of this network is associated with depression, anxiety, rumination, and other negative self-referential thoughts. Evidence suggests that mindfulness, meditation, and yoga may improve DMN functioning. Researchers found in a non-clinical sample that when responding to negative pictures, long-term meditators were more likely to deactivate parts of the DMN with a corresponding attenuation of emotional intensity than were beginning meditators. Continued practice may improve control of attention and thereby improve emotion regulation and the ability to interpret external and internal stimuli in a more positive manner, further reducing initiation of negative thoughts. The thought is that combining yoga with CBT might prove beneficial because of these effects. Additionally, there was a study that was conducted to evaluate a newly developed yoga-enhanced CBT protocol, YCBT, developed by 2 of the authors. This intervention combines CBT and group processes with targeted Kundalini yoga and meditation interventions that may have efficacy for reducing anxiety and elevating mood. So, training for YCBT includes an introduction to yoga cognitive behavioral therapy for mental health professionals, and then also a level 1 elements of YCBT and a level 2 YCBT practicum for mental health professionals, which must be taken in sequence. And for yoga teachers, the same sequence of training is required. It's just more specially designed for yoga teachers rather than mental health professionals. So the introduction to YCBT is priced at $80. It's a foundational half-day training. It offers an introduction to an innovative research-based anxiety management program, and this approach combines scientifically documented effects of yoga with cognitive behavioral therapy. The level 1 elements of YCBT is priced at $180. There's a prerequisite, which is the introduction to YCBT. It's a full-day training which provides participants with comprehensive instruction in facilitating the YCBT group treatment model. Participants learn how to address the symptoms of anxiety and depression by combining traditional psychotherapy with yogic practices and philosophies. And then level 2, YCBT practicum for therapists, is priced at $225. It is a full-day course which teaches participants how to effectively use the 3 components of the manualized YCBT group treatment model: the didactic material, the group therapy process, and the yoga. Participants will receive and review all materials necessary to run the groups, including the leader's manual. And then there is additionally a consultation, which is for participants who have completed the level 1 and level 2 trainings and plan to run YCBT groups for adults in their practices. It's a 6 to 9 session supervisory package for ongoing consultation, and instruction is offered. The consultation is highly recommended for follow-up instruction and oversight. Mental health professionals begin to run groups in their practice.
Why CBT can be used for a multitude of reasons. For one, it can help address trauma-related symptoms. So when someone is experiencing those trauma-related symptoms, specifically like intrusion of thoughts and memories and avoidance of certain triggers or stressors, why CBT can be effective. And we have found that these trauma-related symptoms can be and typically are experienced by those suffering from PTSD, especially women veterans who are suffering from PTSD. Why CBT can also help address emotion dysregulation. So again, going back to those intrusion and avoidance, someone's feeling triggered and goes into a dark place, so to speak. Why CBT can help address that. Studies have also indicated that practicing yoga in combination with CBT can help alleviate some of those symptoms related to PTSD. So again, addressing those emotion dysregulation and those symptoms that people like women veterans experience when they're suffering from PTSD. Why CBT can also help reduce hyperarousal and anxiety symptoms, which are common in connection with PTSD. And we also found that why CBT can also help decrease destructive behaviors, such as using or abusing drugs and alcohol. It's not uncommon from somebody suffering from PTSD to use drugs and alcohol as a coping mechanism, as a way to perhaps escape from their symptoms and all of their triggers. However, there is very little research surrounding women veterans suffering from PTSD, specifically using YCBT, so there is a need for further research.
From an ethical perspective, social workers are here to promote clients' socially responsible self-determination, seek to enhance clients' capacity and opportunity to change, and to address their own needs, which is a part of the Nashua Code of Ethics, Dignity and Worth of a Person. With this in mind, we support our clients' population by diligently working to find alternatives and evidence-based therapies to support their need for a life change. With all aspects of YCBT, from the nuances of yoga, finding presence in the moment, and the group work, this treatment strengthens relationships among people in a purposeful effort to promote, restore, maintain, and enhance the well-being of the individual, family, social group, organization, and community, aligning with the social work ethics of importance of human relationships. By working through the steps necessary to help our clients with an evidence-based alternative, we, as social workers, are continuing to strive to increase our professional knowledge and skill set while working to apply this knowledge for our client population. as we seek to contribute to the knowledge basis of the social work profession by providing you this presentation on why CBT for women veterans with PTSD to you today. Additionally, when considering the ethic of care, why CBT draws on mindfulness in the moment for both the target population and the social workers involved. In working together mindfully, this opens up a space for forming a deeper connection and understanding, furthering our experience by invoking precise attention, moment by moment, to exactly what you are experiencing right now. This provides a path for everyone involved to have their attention support their intention. By practicing mindfully, we provide a fuller experience of treatment with an ethic of care for our clients. Thank you for taking time out of your day to watch and listen to our presentation. We hope that you see the need for alternative solutions to PTSD and further explore the uses of why CBT.